Hello, I'm Darwin, and this is my um, video discussion post for week 1 in PTA 220 therapeutic exercises. 1. So, in every for every therapy session that we're going to be performing with our patients, there are certain standard precautions that we have to consistently follow every time. So these are preparations that we need to do before we engage in performing and facilitating the therapeutic exercises for our patients. Um, Prior to engaging with exercises, we have to find out some background information about the patient. Number one, we have to know if there's any contraindication. If there's that'll determine what type of exercise we can do and what type of exercise we need to avoid or not do for the patient. Um, Also, we need to find out what does the patient what is their preference when it comes to exercising. Do they prefer after breakfast? Do they prefer after lunch? Do they prefer in the morning? Do they prefer in the afternoon? Because that definitely affects the patient's level of motivation and involvement when it comes to doing their exercises. Um, Also, another factor that we need to find out or determine is does the patient believe in the benefits of exercises? Do they need a little pep talk first, a little education on the benefits of exercises before you go into exercises right away? Because if they have doubt, you might want to talk to them first and give them a background information on what a particular exercise will do for them. How is it gonna benefit them? What's in it for them? Um, that's a very big factor, again, that will affect their motivation and level of involvement with your exercise program. And then we also have to consider, the space prior to doing the exercises. Is it enough for the patients to be able to move in? We have to secure or make sure that the area is safe for them, particularly with the kind of injury that they have. Certain type of equipments that we need to prepare so that our exercise program will run smooth. Also, we have to be prepared before performing the exercises involving the patient. We have to be prepared for ourselves, like we know the proper body mechanics in performing transfers. When we engage with the patients, we are expected to help them in terms of mobility, like transferring sit to stand, going from bed to chair, and vice versa. So we have to be aware of our posture and our body mechanics when performing those activities. The way we bend our bodies, we reach for the patient and lift weight. So that's very important in as part of preparations before engaging in your therapeutic exercise. And when we are already performing our exercise, we have to be mindful of how the patient are responding to the exercise program. Like, are they running out of breath or are they turning blue? So we have to be very observant on how they are reacting to the exercise program that we are performing. So those are only a few, as far as I could recall, important things that we need to do in order to prepare and consider and keep in mind while performing therapeutic exercises for the patient. Thanks.